Yeah, I have friends that work in like chronic pain, and I'm like, no, thank you. Like
No.
that is the Lord's work right there, boy.
Yeah. I have patients who have chronic pain and I'm like, okay, well, let's at least get your hot flashes under control.
Yeah, I'll take one.
Might make things a little better. Yeah, I'll
Yeah,
take a slice of the pie.
yeah. So in those situations when I am dealing with somebody with a worse pain in life, or you're dealing with somebody that's experienced their menopausal symptoms for the first time, how do you lay out like a reasonable understanding, caring future without overpromising? Because you may not be able to get them under control, right? Or they may get
Yeah.
worse, right? And that's the tough part of what we do. But what have you learned there?
Yeah, so I mean, I do prescribe a lot of hormone therapy, right? Following the North American Menopause Society guidelines and just sort of what we have available for hormone therapy options. And I always sort of like to manage expectations and say, we might have to try a couple different things. I always start at the lowest dose and work our way up and just sort of, I think when you lay it out to patients that like, this is a long game, this is not a short term, like, yes, we might put you on progesterone and it might be immediate change. Cool. We might have to navigate in a year or 2 years when your hormones change more as you sort of head towards menopause. And I think when people understand that it's a long game, this doesn't really happen overnight and it doesn't get fixed overnight. We're also always just looking to improve symptoms, improve quality of life, improve symptoms, and also obviously outcomes with, bone loss and osteoporosis and things like that. But I think again that when they trust you and they like you, because that matters too. When you have that established foundation with them and that you do all the safety screening and you look at risk factors and you have approved hormone therapy. So yeah, this is, I think, our best option. We are expecting your hot flashes to improve. And I always say, I'm not saying they're going to go away, but I'm saying, in the next couple of weeks of this estrogen patch or whatever we're going to use, we are hoping that the severity, frequency, and intensity decreases. And they're like, okay. So we do the questions right now. Where are you at with these hot flashes? And they're like, hey, 15 times a day, and they last for 30 seconds, and they're really bad. Like, hey, well, then in a month you come back and you're like, you know what? I get like one a day. I'm like, hallelujah. That is a substantial improvement, right? Again, they might not be gone, but we're always just looking for improvement, right? And then just that close monitoring, but when you lay it out from the beginning of these expectations and what our anticipated things are, and again, it's hormones, right? So everyone's a little bit different. Everyone's at a bit different stage. They don't really test them because serum values for hormones are also wacky or menopause. Then they're hooked. They're like, okay, yeah, I'm ready to deal with it. They're ready for any improvement, really.
Thanks for tuning in to this episode of Trust Driven Insights, brought to you by TrustDrivenCare. Imagine a world where all your patient communication is in one place, seamless, effortless, and on autopilot. That's the power of Trust-Driven Care. If you're ready to streamline your practice, check out TrustDrivenCare.com and see what's possible. Trust-Driven Insights. Real conversations. Smarter care. Stronger business.